Hi, I'm Dr. Rob Rutledge. I'd like to introduce myself by reflecting on what I consider to be the attributes of remarkable cancer survivors. I first learned about that idea in the late 1980s when I was a medical student and not knowing what kind of doctor I wanted to be. And I had one of those life-altering experiences, the book kind of falling off the shelf. And the book was called Love, Medicine, and Miracles by Dr. Bernie Siegel. And Bernie was a cancer surgeon in an Ivy League medical school and a real pioneer in support groups. And what he had noticed is that his exceptional patients, his patients who did exceptionally well, had certain personality traits. So these are the patients whose tumors shrunk much faster than expected on therapy, who got through their difficult treatments, who recovered from their side effects, who far outlived the expectations of their doctors. And he thought they had a certain personality disposition. And in fact, the medical trials over the years of people who have undergone spontaneous remission also show these same personality traits. And just as an aside, I don't actually break up the world into those people who do exceptionally well and those people who don't, because I really think we all have that capacity to do incredibly well and to heal our lives in some very deep sense. But what Bernie wrote was his exceptional cancer patients were able to truly accept their diagnosis. And by acceptance, I don't mean resignation, giving up, giving in, no longer kind of trying. It's more like seeing the truth for what it is. This is my starting point, and having that sense of peace and calm despite the very, very trying circumstances in their life. The second attribute is that of authenticity, truly willing to listen to oneself, to tap into that incredible inner wisdom that we all have in some sense, and to no longer consider what society expects or our friends or family expected, to kind of believe in ourselves. And that, in a sense, translates into autonomy, which is being proactive. And so, for instance, when we decide to exercise or to eat well, it's an incredible meta message from our mind and spirit to our body about healing and wholeness. And so taking that proactive step is part of being exceptional. And for instance, as another kind of attribute or idea that the exceptional cancer patients followed was that they no longer viewed recurrence or even death as a failure. They were more interested in focusing their energy on the things they could control and letting go of the things they couldn't control. And so when we focus our energy, our attitudes, and our relationships on being able to appreciate the incredible beauty and sacredness within this world, I think that sets up an incredible kind of physiology, what I call the physiology of love, that actually percolates through the mind and body to actually facilitate the kind of the physical healing itself. So when I organize a public talk or a keynote address or a workshop or a retreat, I want to offer that kind of full range of ideas to provide people with the practical advice, body, mind, and spirit. I like to teach them the skills, or at least point them towards where those skills can be around meditation, relaxation, and reframing difficult thoughts and ideas, and to offer the stories, because really the stories are incredibly powerful in terms of having people recognize their own strength, their own resilience, their own ability to tap into that incredible resource of healing. So as you can see, I'm quite passionate. I've been working as a full-time physician in the cancer center, cancer specialist for the last 17 years, resident before that. I'm passionate about working with people with cancer. Would love to be able to work with your organization or your audience and just create that experience as the best possible experience for your audience. So hope that you contact me. Thanks a lot for watching this video, and take care.